Question 1. What is the primary reason for a personal support worker, PSW, to use proper body mechanics when assisting a client? A. To make the task quicker. B. To prevent injury to themselves and the client. C. To demonstrate physical strength. D. To improve the client's muscle tone. Answer: B. To prevent injury to themselves and the client. The concept being tested here is the fundamental importance of proper body mechanics in healthcare. The keyword primary reason emphasizes the most critical outcome. Proper body mechanics, which involves using the body efficiently and safely, is essential to protect both the PSW from strain and injury and the client from accidental harm during transfers or repositioning. For example, lifting with your legs instead of your back helps prevent a serious back injury for the PSW. Always remember that your safety and the client's safety are paramount in every task involving movement. Question 2. Before assisting a client to transfer from a bed to a wheelchair, what is the most important initial step for the PSW? A. Position the wheelchair directly in front of the bed. B. Ensure the client has eaten a meal. C. Lock the wheels of the bed and the wheelchair. D. Ask the client to stand up independently first. Answer: C. Lock the wheels of the bed and the wheelchair. This question tests knowledge of client safety protocols during transfers. The keyword most important initial step directs you to the critical first action for preventing accidents. Locking the wheels of both the bed and the wheelchair ensures stability, preventing them from moving unexpectedly during the transfer and significantly reducing the risk of a fall for the client and injury to the PSW. Imagine trying to transfer someone into a chair that suddenly rolls away. It's a recipe for disaster. Always secure equipment before beginning any transfer to ensure a safe foundation. Question 3. A client with a weak left side needs assistance to walk. What is the correct position for the PSW to stand when using a gait belt? A. On the client's stronger right side. B. On the client's weaker left side. C. Directly in front of the client. D. A few steps behind the client. Answer: B. On the client's weaker left side. This question assesses proper assisting techniques for ambulation, specifically when a client has unilateral weakness. The crucial phrase weak left side indicates where the client needs the most support. When assisting a client with a gait belt, the PSW should stand on their weaker side, slightly behind them, to provide immediate support and prevent falls if they lose balance. For example, if the client's left leg gives out, the PSW is right there to brace them. Always remember to guard the weaker side, as this is where the client is most vulnerable. Question 4. What is a key principle of good body alignment for a client in a supine position, lying on their back? A. Head should be turned sharply to one side. B. Legs should be crossed at the ankles. C. Back should be flat with minimal arch, supported by a pillow if needed. D. Arms should be tucked under their body. Answer: C. Back should be flat with minimal arch, supported by a pillow if needed. This question focuses on the principles of good body alignment, which is essential for comfort and preventing pressure injuries. The keyword supine position specifies the client's orientation. Good body alignment means maintaining the body's natural curves and supporting joints, ensuring the spine is as straight as possible to prevent strain and promote circulation. For instance, placing a small pillow under the head and neck, and sometimes a small one under the knees, helps maintain natural alignment without creating pressure points. Always strive to keep the client's body in a straight line, resembling good standing posture, to promote comfort and prevent complications. Question 5. When should a gait belt not be used? A. When assisting a client with a history of falls. B. When transferring a client from a bed to a wheelchair. C. When a client has an abdominal incision or ostomy. D. When assisting a client to ambulate short distances. Answer: C. When a client has an abdominal incision or ostomy. This question tests your knowledge of contraindications for using a gait belt, a critical safety aspect. The keyword "not be used" signals that you are looking for a situation where it would be unsafe or inappropriate. A gait belt should not be applied to clients with recent abdominal surgery, ostomies, or certain medical devices in the abdominal area, as the pressure could cause pain, injury, or dislodge equipment. For example, applying a gait belt over a new colostomy bag could damage the stoma or cause leakage. Always check for any conditions that would make a gait belt unsafe before use, protecting the client from unnecessary harm. Question 6. What is the main purpose of repositioning a bedridden client every 2 hours? A. To provide them with a change of scenery. B. To prevent the development of pressure injuries, bed sores. C. To increase their appetite. D. To allow the PSW to take a break. Answer: B. To prevent the development of pressure injuries, bed sores. This question tests the crucial concept of skin integrity and repositioning. The phrase "main purpose" points to the most significant benefit of this routine task. Repositioning a bedridden client regularly, typically every 2 hours, helps relieve pressure on bony prominences, improving blood circulation and preventing the formation of painful and serious pressure injuries, also known as bed sores. For instance, if a client always lies on their back, pressure builds on their sacrum, which can lead to skin breakdown. Remember, consistent repositioning is a primary defense against pressure injuries, directly impacting the client's comfort and health. Question 7. When using a mechanical lift to transfer a client, what is the most important step before lifting the client off the surface? A. Ensure the client's feet are flat on the floor. B. Tell the client to hold onto the lift's frame. C. Check that the sling is correctly positioned and securely attached to the lift. D. Ask the client to help push off the bed. Answer: C. Check that the sling is correctly positioned and securely attached to the lift. This question focuses on safety procedures for mechanical lifts, highlighting a critical pre-lift check. The phrase "most important step before lifting" emphasizes a foundational safety measure. Ensuring the sling is correctly positioned and securely attached to the lift is paramount because a poorly attached or positioned sling can lead to the client falling out, causing severe injury. For example, if a sling hook isn't fully engaged, it could detach during the lift. Always double-check all connections and positioning to ensure complete client security before any movement with a mechanical lift. Question 8. A client begins to fall while walking with a PSW. What is the immediate and safest action for the PSW to take? A. Try to stop the fall by pulling the client upwards. B. Guide the client gently to the floor. C. Run for help immediately. D. Let go of the client and step back. Answer: B. Guide the client gently to the floor. This question addresses an emergency scenario during ambulation, testing the PSW's ability to react safely to a fall. The keywords "immediate" and "safest action" guide you to the best protective measure. If a client begins to fall, the PSW should not try to prevent the fall completely, as this can cause injury to both the client and the PSW, but instead, guide them down gently to the floor, protecting their head and neck, to minimize the impact. For instance, if holding a gait belt, carefully lower the client by lowering yourself, using your leg as a slide. Always prioritize a controlled descent to reduce the risk of more severe injury during a fall. Question 9. What is a common cause of falls in the home environment for older adults? A. Daily exercise routines. B. Bright, well-lit rooms. C. Loose rugs or cluttered pathways. D. Eating a balanced diet. Answer: C. Loose rugs or cluttered pathways. This question tests knowledge of common environmental hazards contributing to falls. The phrase common cause of falls in the home environment points to typical household risks. Loose rugs, clutter, poor lighting, and wet floors are frequent culprits for falls among older adults, creating tripping hazards. For example, a throw rug without a non-slip backing can easily slide, causing someone to lose their balance. It's crucial to regularly assess and clear client living spaces of such hazards to promote a safer environment. Question 10. When assisting a client to get out of bed, where should the PSW position themselves? A. On the side of the bed opposite to where the client will get out. B. At the foot of the bed, facing the client. C. On the side of the bed where the client will get out, facing the client. D. Behind the client, pushing them forward. Answer: C. On the side of the bed where the client will get out, facing the client. This question assesses the correct positioning for a PSW during a bed-to-sitting transfer, which is crucial for safety and effective assistance. Positioning on the side of the bed where the client will exit, facing them, allows the PSW to provide direct physical support, maintain eye contact, and guide the movement effectively. For example, the PSW can brace the client's knees and help them pivot. This ensures the PSW is in the best position to assist with balance and provide support if the client becomes unsteady. Question 11. What action should a PSW take if a client reports sudden, severe chest pain? A. Encourage them to lie down and rest. B. Give them a glass of water. C. Call for emergency medical help immediately. D. Tell them it is probably indigestion. Answer: C. Call for emergency medical help immediately. This question tests the PSW's response to a critical medical emergency. The keywords sudden, severe chest pain are major red flags for a potential heart attack or other serious cardiac event. In such a situation, the PSW must immediately call for emergency medical help, e.g., 911, or activate the facility's emergency response system, and stay with the client, providing reassurance and following any specific instructions from emergency services. For example, they might be instructed to help the client into a comfortable position while waiting for paramedics. Always remember that severe chest pain is a medical emergency requiring immediate professional intervention. Question 12. What is the most important factor to consider when determining the type of transfer technique to use for a client? A. The client's preference for a specific technique. B. The time of day the transfer is taking place. C. The client's current physical ability and weight-bearing status. D. The number of PSWs available at that moment. Answer: C. The client's current physical ability and weight-bearing status. This question focuses on client assessment and individualized care planning for transfers. The phrase "most important factor" highlights the primary determinant for safe and effective transfers. The client's ability to bear weight, their strength, balance, and overall physical condition directly dictate whether they need minimal assistance, a stand pivot transfer, or a mechanical lift. For example, if a client cannot bear weight on one leg, a stand pivot transfer is inappropriate, and a mechanical lift might be required. Always assess the client's capabilities thoroughly before choosing any transfer method to ensure their safety and dignity. Question 13. When moving a client up in bed, what technique helps prevent friction and shearing injuries to the skin? A. Pulling the client quickly by their arms. B. Having the client push with their feet while the PSW uses a draw sheet. C. Sliding the client without lifting them. D. Moving the client by pushing on their shoulders. Answer B. Having the client push with their feet while the PSW uses a draw sheet. This question addresses the prevention of skin breakdown during repositioning. The keywords friction and shearing injuries point to specific types of skin damage. Using a draw sheet or lift sheet, with the client assisting by pushing with their feet, if able, minimizes direct skin contact with the bed linens and reduces the dragging force that causes friction and shearing. For example, instead of pulling the client directly on the sheets, the draw sheet allows for a smoother, lifted movement. Always remember to use assistive devices like draw sheets to protect the client's skin, especially when moving them up in bed. Question 14. What is the purpose of a transfer belt or gait belt? A. To restrict a client's movement. B. To provide a secure grasp point for the PSW during transfers and ambulation. C. To measure the client's waist circumference. D. To apply pressure to the client's abdomen. Answer B. To provide a secure grasp point for the PSW during transfers and ambulation. This question defines the core function of a widely used assistive device. The term transfer belt or gait belt refers to a safety device. Its primary purpose is to give the PSW a firm and secure area to hold onto the client, offering stability and control during transfers, repositioning, or assisting with walking, without grabbing directly onto the client's clothing or skin. For instance, if a client begins to sway while standing, the PSW can gently hold the belt to stabilize them. Always use a gait belt to enhance safety and provide controlled support, not to restrict movement. Question 15. A client using a walker should be taught to do what first when approaching a doorway? A. Turn the walker sideways and push it through. B. Walk through the doorway first, then pull the walker. C. Push the walker a short distance ahead, then step into it. D. Lift the walker and carry it through. Answer C. Push the walker a short distance ahead, then step into it. This question focuses on the correct and safe use of a walker, particularly in common navigational situations. When approaching a doorway or any obstacle, the client should move the walker slightly ahead, then step into the walker, moving their body forward. This maintains stability and prevents the walker from getting stuck or the client from tripping. For example, they push the walker a foot or so, then take a step or two to catch up. Always teach clients to move their mobility aid first, then their body, maintaining a steady, controlled rhythm. Question 16. What is the most appropriate way for a PSW to lift a heavy object from the floor? A. Bend at the waist with straight legs. B. Keep legs straight, bend knees slightly, and use arm strength. C. Squat down, keeping the back straight, and lift with leg muscles. D. Twist the body while lifting to get a better angle. Answer C. Squat down, keeping the back straight, and lift with leg muscles. This question directly tests the principles of proper body mechanics for lifting. The keyword most appropriate way indicates the safest and most efficient method. To lift a heavy object, a PSW should squat down by bending their knees, keeping their back straight, and using the powerful leg muscles to lift, rather than straining their back. For example, when picking up a dropped item, bend your knees, keep the item close to your body, and stand up using your legs. Always remember to lift with your legs, not your back, to prevent musculoskeletal injuries. Question 17. What should be done before attempting to transfer a client from their bed to a chair? A. Offer the client a snack and drink. B. Ensure the client is wearing non-slip footwear. C. Ask the client to hold their breath. D. Turn on loud music to distract the client. Answer B. Ensure the client is wearing non-slip footwear. This question addresses pre-transfer safety precautions. The keyword before attempting highlights a preparatory step that is crucial for client safety. Ensuring the client wears non-slip footwear provides stability and traction, reducing the risk of slipping or falling during the transfer, especially when their feet touch the floor. For example, socks alone are often too slippery, so proper shoes or non-slip socks are essential. Always make sure the client has secure footing to prevent accidental slips and falls during any movement or transfer. Question 18. A client is restless and attempting to climb out of bed despite safety rails being up. What is the first action a PSW should take? A. Apply a restraint to the client immediately. B. Stay with the client and try to reorient and calm them. C. Leave the room to find the nurse in charge. D. Lower all the bed rails to prevent them from climbing over. Answer B. Stay with the client and try to reorient and calm them. This question tests the appropriate response to a client who is agitated and at risk of falling, emphasizing safety and non-restraint approaches. The keyword first action indicates the initial and most crucial step. Before considering any restrictive measures, a PSW must try to understand the cause of the restlessness, offer reassurance, and reorient the client to their surroundings, aiming to calm them and prevent an unsafe situation. For example, the client might be confused, cold, or need to use the washroom. Direct interaction and comfort are always the primary interventions to address client agitation safely. Question 19. When repositioning a client in a wheelchair, how often should this typically occur to prevent pressure injuries? A. Every 30 minutes. B. Every 2 hours. C. Every 4 hours. D. Once a day. Answer A. Every 30 minutes. This question focuses on the frequency of repositioning for clients in a wheelchair to prevent skin breakdown. While bedridden clients are typically repositioned every 2 hours, clients in wheelchairs bear more direct pressure on their buttocks and sacrum, requiring more frequent shifts. Repositioning every 15 to 30 minutes helps alleviate this pressure, promoting circulation and preventing pressure injuries. For example, assisting the client to shift their weight or adjusting their posture in the chair can make a significant difference. Regular, small adjustments are key to protecting skin integrity for clients using wheelchairs. Question 20. What is the purpose of raising the head of the bed to a sitting position before a transfer? A. To make the bed look neater. B. To help the client adjust to an upright position and prevent orthostatic hypotension. C. To allow the PSW to easily change the bed linens. D. To encourage the client to go back to sleep. Answer B. To help the client adjust to an upright position and prevent orthostatic hypotension. This question addresses a common pre-transfer procedure and its physiological benefit. Raising the head of the bed gradually allows the client's circulatory system to adjust to an upright position, preventing a sudden drop in blood pressure, orthostatic hypotension, which can cause dizziness, lightheadedness, or fainting. For example, if a client gets up too quickly, they might feel dizzy and fall. Giving the client a moment to sit up and dangle their legs helps stabilize their blood pressure and prepares them safely for standing. Question 21. A client who uses a cane should hold it on which side of their body? A. On their stronger side. B. On their weaker side. C. In both hands. D. It doesn't matter which side. Answer: A. On their stronger side. This question tests the correct and safe use of a mobility aid like a cane. A client should hold the cane on their stronger side to provide support to the opposite, weaker leg. This allows the cane to bear weight and stabilize the stronger side, thus supporting the overall balance as the weaker leg moves. For example, if a client has a weak right leg, they should hold the cane in their left hand. Remembering this helps ensure the client receives maximum support where it is most effective. Question 22. What is the role of a PSW regarding client care plans related to mobility and transfers? A. To create new mobility plans independently. B. To follow the established care plan and report any changes in client ability. C. To decide which equipment the client should use. D. To modify the care plan if it seems incorrect. Answer: B. To follow the established care plan and report any changes in client ability. This question clarifies the PSW's scope of practice concerning client care plans. A PSW's role is to meticulously follow the care plan developed by a regulated healthcare professional, like a nurse or therapist, and to observe and report any changes in the client's condition or ability, rather than making independent decisions or modifications. For example, if a client who was able to ambulate with a cane suddenly becomes much weaker, the PSW reports this to the supervisor, who may then reassess the care plan. Adhering to the care plan and reporting observations ensures consistent and safe care. Question 23. What is the correct way to position a client's feet before a stand pivot transfer? A. With feet together and flat on the floor. B. With feet spread wide apart, pointing outwards. C. With feet flat on the floor, slightly apart, with the stronger foot slightly ahead. D. With feet dangling off the edge of the bed. Answer: C. With feet flat on the floor, slightly apart, with the stronger foot slightly ahead. This question focuses on optimal client positioning for a safe and effective stand pivot transfer. Positioning the client's feet flat on the floor, slightly apart for a stable base, with the stronger foot slightly ahead, prepares them to push off and pivot. This stance maximizes their ability to bear weight and maintain balance during the transfer. For instance, if the client is pivoting to their left, their right, stronger, foot might be slightly forward. Proper foot placement is foundational for a smooth and controlled transfer. Question 24. What should a PSW do if a client consistently refuses to participate in their prescribed mobility exercises? A. Force the client to do the exercises. B. Document the refusal and report it to the supervisor. C. Tell the client they will not get better if they refuse. D. Skip the exercises for that day and try again tomorrow. Answer: B. Document the refusal and report it to the supervisor. This question addresses client rights and the PSW's responsibility when a client refuses care. Clients have the right to refuse treatment or activities. The PSW's role is not to force them, but to respect their decision, document the refusal, and report it to the supervisor or nurse. For example, the supervisor might need to assess why the client is refusing, perhaps due to pain, fatigue, or misunderstanding. Always ensure client autonomy is respected while also reporting important changes or non-compliance to the healthcare team for further assessment. Question 25. Which of the following is considered an environmental safety hazard for a client with mobility issues? A. A clear, open hallway. B. A well-placed grab bar in the bathroom. C. Dim lighting in stairwells. D. A firm, supportive mattress. Answer, C. Dim lighting in stairwells. This question assesses the identification of environmental safety hazards. The phrase environmental safety hazard refers to elements in the client's surroundings that could cause harm. Dim lighting, especially in areas like stairwells, significantly reduces visibility and increases the risk of missteps and falls for anyone, but particularly for clients with mobility issues or impaired vision. For example, a dimly lit stairwell can make it hard to see the edge of steps. Always ensure adequate lighting in all areas, especially where movement and changes in elevation occur, to prevent accidents. Question 26. When assisting a client to sit up on the edge of the bed, dangling, what is the primary benefit? A. To help the client empty their bladder. B. To prepare the client for standing and allow blood pressure to stabilize. C. To allow the PSW to clean the bed. D. To assess the client's foot circulation. Answer, B. To prepare the client for standing and allow blood pressure to stabilize. This question tests the purpose of a common pre-transfer maneuver. Dangling refers to the client sitting on the edge of the bed with their feet on the floor. The primary benefit is to allow the client's body, particularly their cardiovascular system, to adjust to the upright position, preventing dizziness or fainting caused by a sudden drop in blood pressure, orthostatic hypotension, before they stand. For example, waiting a minute or two after dangling can prevent a client from feeling lightheaded upon standing. This step is crucial for safe transitions from lying to standing. Question 27. What is the maximum height a bed should be raised for safe working posture for a PSW when providing care? A. To the PSW's waist level. B. To the PSW's knee level. C. To the highest possible setting. D. To the client's chest level. Answer, A. To the PSW's waist level. This question focuses on ergonomic principles for PSWs to prevent injury while providing care. The maximum height for safe working posture is typically at the PSW's waist level. Raising the bed to this height minimizes bending and reaching, allowing the PSW to use proper body mechanics and avoid straining their back or shoulders during tasks like repositioning or personal care. For example, when making a bed, having it at waist height means you're not constantly leaning over. Always adjust the bed height to a comfortable and safe level for yourself to protect your body. Question 28. What type of transfer would be most appropriate for a client who can bear some weight on their legs but needs significant assistance with balance? A. Independent transfer. B. Stand pivot transfer with a gait belt. C. Two-person lift without assistive devices. D. Mechanical lift. Answer, B. Stand pivot transfer with a gait belt. This question asks for the most suitable transfer technique based on a client's partial weight-bearing ability and balance issues. A stand pivot transfer with a gait belt is ideal for clients who can bear some weight but require support to pivot and maintain balance, as the gait belt provides a secure handhold for the PSW to assist. For example, this is commonly used to transfer someone from a bed to a bedside commode. This method allows the client to participate while ensuring their safety and stability with the PSW's support. Question 29. What is a key component of a comprehensive fall prevention program for clients? A. Limiting client activity to bed rest. B. Regular assessment of fall risk factors. C. Removing all furniture from client rooms. D. Administering sedatives to keep clients calm. Answer B. Regular assessment of fall risk factors. This question addresses proactive fall prevention strategies. The phrase key component highlights an essential element of a holistic approach to safety. Regular assessment of fall risk factors, such as medication side effects, impaired vision, muscle weakness, or environmental hazards, allows the healthcare team to identify at-risk clients and implement targeted interventions. For example, knowing a client has orthostatic hypotension can lead to a plan to dangle their legs before standing. Continuous assessment is crucial for tailoring individualized prevention strategies and adapting them as a client's condition changes. Question 30. Why is it important to ensure a client's privacy and dignity during transfers and repositioning? A. It is a legal requirement only for specific transfers. B. It helps build trust and respect, promoting client cooperation. C. It speeds up the transfer process. D. It reduces the need for assistive devices. Answer B. It helps build trust and respect, promoting client cooperation. This question emphasizes the ethical and practical importance of respecting client dignity. Ensuring privacy and dignity during transfers and repositioning, such as using drapes or keeping them covered, fosters a trusting relationship and encourages the client's cooperation. Clients feel more comfortable and secure when their personal boundaries are respected. For example, drawing curtains or closing the door before helping a client change position maintains their privacy. Always prioritize dignity, as it enhances the client's well-being and willingness to participate in their care. Question 31. After a client has fallen, and before moving them, what is the first immediate action the PSW should take? A. Try to get the client back up immediately. B. Call for help, e.g., nurse, supervisor, and assess the client for injuries. C. Offer the client food and water. D. Document the fall in the client's chart. Answer B. Call for help, e.g., nurse, supervisor, and assess the client for injuries. This question addresses the immediate post-fall protocol. The keyword first immediate action after a fall highlights the priority. The PSW must not move the client until a thorough assessment for injuries has been completed by a regulated health professional, like a nurse, and help has been called, as moving an injured client could worsen their condition. For example, if the client has a broken hip, moving them could cause more damage. Always prioritize assessing for injury and seeking professional help before any movement to ensure the client's safety. Question 32. What is the safe practice for handling a client's extremities during repositioning or transfers? A. Pulling on joints like wrists or ankles. B. Lifting under joints to support the limb. C. Supporting the limb above and below the joint. D. Allowing the limb to dangle freely. Answer C. Supporting the limb above and below the joint. This question focuses on protecting client limbs from injury during movement. The phrase safe practice for handling a client's extremities points to the correct technique. When moving an arm or leg, the PSW should support the limb above and below the joint, distributing the weight and preventing strain or injury to the joint itself. For example, when moving a client's leg, support it at the thigh and the calf, rather than just pulling on the ankle. Always remember to provide stable, comprehensive support to limbs to prevent unnecessary stress on joints. Question 33. When performing a pivot transfer with a client, what instruction should the PSW give to the client regarding their head? A. Look down at your feet. B. Look straight ahead. C. Look in the direction you are moving. D. Close your eyes. Answer, C. Look in the direction you are moving. This question tests a specific cue for a stand pivot transfer that aids in balance and coordination. Instructing the client to look in the direction you are moving encourages natural body alignment and helps them initiate the pivot with their head and shoulders, which facilitates the rest of the body turning. For example, if transferring from bed to a wheelchair on their right, tell them to look towards the wheelchair. This simple instruction improves the client's balance and makes the transfer smoother and safer. Question 34. What is the purpose of using bed rails? A. To secure clients in bed at all times. B. To prevent clients from falling out of bed. C. To provide a place for clients to hang their clothes. D. To keep the bed linens tidy. Answer, B. To prevent clients from falling out of bed. This question addresses the primary safety function of bed rails. Bed rails are designed to act as a physical barrier to prevent clients, especially those at high risk of falling or who may be disoriented, from accidentally rolling or falling out of bed. For example, if a client is restless or confused, bed rails can offer a degree of protection during sleep. While they can serve as a supportive grip for some clients to move, their main role is fall prevention from the bed itself. Question 35. What is the maximum number of times a PSW should attempt to lift or transfer a client if struggling, before seeking assistance? A. Once. B. Twice. C. 3 times. D. There is no limit. Answer, A. Once. This question emphasizes a critical safety rule for PSWs during transfers. If a PSW struggles even once while attempting to lift or transfer a client, they should stop immediately and seek assistance. Continuing to try alone increases the risk of injury to both the client and the PSW. For example, if you can't get a client to pivot safely on the first try, ask another PSW for help or consider a different transfer method. Your safety and the client's safety are always the priority, so never hesitate to ask for help. Question 36. Which of the following is an example of an appropriate non-restraint intervention for a confused client attempting to get out of bed? A. Tying the client's arms to the bed. B. Patting the floor around the bed with mats. C. Using a vest restraint. D. Raising all 4 bed rails and leaving the client unsupervised. Answer, B. Patting the floor around the bed with mats. This question tests knowledge of non-restraint alternatives for client safety. The keyword non-restraint intervention highlights a strategy that protects the client without restricting their movement. Patting the floor with mats is a proactive measure that cushions a potential fall if the confused client does manage to get out of bed, minimizing injury without physical restraint. For example, if a client frequently attempts to get out of bed unsupervised, floor mats offer a layer of safety. Always prioritize interventions that promote client safety and dignity while avoiding physical restraints whenever possible. Question 37. What should be done with soiled linens removed from a client's bed during repositioning? A. Place them on the floor temporarily. B. Shake them out to remove debris. C. Place them directly into a designated laundry hamper. D. Store them on a clean surface to sort later. Answer, C. Place them directly into a designated laundry hamper. This question addresses proper infection control practices during linen handling. Soiled linens, which may contain bodily fluids or microorganisms, should be placed immediately into a designated laundry hamper or bag without shaking them or placing them on other surfaces. This minimizes the spread of germs and prevents cross-contamination. For example, carrying a laundry bag directly to the hamper prevents droplets from spreading. Always handle soiled linens with care and dispose of them promptly and correctly to maintain a hygienic environment. Question 38. When assisting a client with ambulation using a walker, the PSW should stand A. in front of the client, pulling them forward. B. to the side and slightly behind the client, holding a gait belt. C. several feet behind the client, giving verbal cues. D. on the client's side that is furthest from the wall. Answer, B. to the side and slightly behind the client, holding a gait belt. This question describes the correct and safe position for a PSW when assisting a client who is walking with a walker. Standing to the side and slightly behind the client, while holding a gait belt, allows the PSW to provide immediate support if the client loses balance or the walker becomes unsteady. For example, if the client stumbles, the PSW can quickly brace them using the gait belt. This positioning ensures maximum safety and immediate assistance without interfering with the client's natural gait. Question 39. What is the purpose of applying anti-embolic stockings, TED hose? A. to keep the client's legs warm. B. to prevent the formation of blood clots, DVT, in the legs. C. to promote swelling in the feet. D. to assist with ambulation. Answer, B. to prevent the formation of blood clots, DVT, in the legs. This question tests knowledge of a specific medical intervention and its purpose. Anti-embolic stockings, also known as TED hose, are designed to apply gentle, graduated compression to the legs. This compression helps improve blood circulation, preventing blood from pooling in the leg veins and significantly reducing the risk of deep vein thrombosis, DVT, which are dangerous blood clots. For example, clients who are immobile after surgery often wear these to prevent complications. Always ensure they are applied smoothly, without wrinkles, to be effective and safe. Question 40. Before assisting a client into a wheelchair, what is crucial to check about the wheelchair itself? A. if it has been recently cleaned and polished. B. if the tires are fully inflated. C. if the brakes are locked and the footrests are swung away or removed. D. if the seat cushion matches the room decor. Answer, C. if the brakes are locked and the footrests are swung away or removed. This question focuses on essential safety checks for a wheelchair before a client transfer. The keywords crucial to check emphasize a non-negotiable safety step. Locking the brakes prevents the wheelchair from moving during the transfer, and swinging away or removing the footrests prevents the client's feet from tripping or getting caught. For instance, if the brakes aren't locked, the chair could roll away as the client attempts to sit. These steps create a stable and unobstructed path, significantly reducing the risk of falls and injury during transfers. Question 41. What type of bed position involves the head of the bed being elevated 45 to 60 degrees? A. Supine position. B. Prone position. C. Fowler's position. D. Trendelenburg position. Answer, C. Fowler's position. This question tests knowledge of common client bed positions. Fowler's position specifically refers to a semi-sitting position where the head of the bed is elevated between 45 to 60 degrees. This position is often used to promote comfort, ease breathing, or facilitate eating and conversation. For example, a client with respiratory difficulty might find it easier to breathe in Fowler's position. Understanding different bed positions is vital for providing comfort and meeting specific medical needs. Question 42. When should a client's care plan be reviewed or updated regarding mobility? A. Only once a year during their annual checkup. B. When there is a significant change in the client's physical ability or health status. C. When the PSW feels like a change is needed. D. Only if the client complains about the current plan. Answer B. When there is a significant change in the client's physical ability or health status. This question addresses the dynamic nature of care planning. Care plans for mobility should be reviewed and updated whenever there is a significant change in the client's condition, whether it's an improvement or a decline in their physical ability or overall health. This ensures the plan remains appropriate and safe, adapting to their current needs. For instance, if a client recovers strength after an illness, they might need less assistance, or if they decline, they might need more. Regular assessment and timely updates are key to providing effective and safe care. Question 43. What is the primary purpose of range of motion, ROM, exercises? A. To build muscle strength. B. To maintain joint flexibility and prevent stiffness or contractures. C. To improve cardiovascular health. D. To increase client appetite. Answer B. To maintain joint flexibility and prevent stiffness or contractures. This question defines the core benefit of range of motion exercises. The primary purpose of ROM exercises is to move a joint through its full extent of movement, which helps to maintain flexibility, prevent joint stiffness, and avert the development of contractures, permanent shortening of muscle or tissue that causes deformity. For example, gently moving an immobile client's arm through its full range of shoulder movement helps keep the joint supple. Regular ROM exercises are vital for preserving mobility and preventing debilitating complications. Question 44. What should a PSW always do before starting any transfer or mobility assistance? A. Discuss personal problems with the client. B. Explain the procedure to the client and gain their cooperation. C. Offer the client a cigarette. D. Watch television with the client. Answer B. Explain the procedure to the client and gain their cooperation. This question tests a fundamental principle of client-centered care and safety. Before initiating any transfer or mobility assistance, the PSW must explain the procedure to the client in clear, simple terms and secure their cooperation. This ensures the client understands what will happen, can participate safely, and feels respected, reducing anxiety and promoting a smoother process. For instance, explaining "we're going to stand up on the count of 3" helps the client prepare. Always communicate effectively to empower the client and ensure their active participation in their care. Question 45. Which intervention is most effective in preventing pressure injuries for a client who is able to move independently? A. Applying thick layers of petroleum jelly to the skin. B. Encouraging frequent repositioning and shifting weight. C. Keeping the client sedated to prevent movement. D. Limiting fluid intake to reduce incontinence. Answer B. Encouraging frequent repositioning and shifting weight. This question focuses on active prevention of pressure injuries for mobile clients. The keyword "most effective" points to the strategy with the greatest impact. For clients who can move independently, actively encouraging them to frequently reposition themselves, shift their weight, or get up and walk if possible, is the most effective way to relieve pressure and prevent skin breakdown. For example, reminding a client in a chair to stand up or adjust their position every 15 to 30 minutes. Empowering clients to manage their own positioning is key to maintaining skin integrity. Question 46. If a client uses crutches, what is the correct way for them to go upstairs? A. Lead with the crutches, then the weaker leg, then the stronger leg. B. Lead with the weaker leg, then the crutches, then the stronger leg. C. Lead with the stronger leg, then the crutches, then the weaker leg. D. Lead with both crutches and both legs simultaneously. Answer: C. Lead with the stronger leg, then the crutches, then the weaker leg. This question tests the specific technique for safely ascending stairs with crutches. When going upstairs, the client should lead with the stronger leg, lifting it onto the next step, then follow with the crutches and the weaker leg together. This provides maximum stability and leverage, using the stronger leg to bear the initial weight. For example, "Good leg goes to heaven" is a common memory aid. Remember this sequence for safe stair climbing: strong leg first, then crutches and weak leg. Question 47. What is the main reason to check the client's medical chart or care plan before any mobility assistance? A. To see what the client ate for breakfast. B. To confirm specific instructions, precautions, and the client's current weight-bearing status. C. To find out the client's preferred television channel. D. To determine if the client has any visitors scheduled. Answer: B. To confirm specific instructions, precautions, and the client's current weight-bearing status. This question emphasizes the critical importance of reviewing the care plan before providing mobility assistance. The main reason is to ensure you are fully aware of any specific instructions, such as whether a client is partial or non-weight-bearing, any precautions like recent surgery, or if specific equipment is required. This information is crucial for safe and appropriate care. For example, the care plan might state non-weight-bearing on left leg, which dictates using a mechanical lift instead of a stand pivot. Always consult the care plan to ensure you're providing care that aligns with the client's current needs and limitations. Question 48. A client has fallen and is unconscious but breathing. What is the immediate first aid priority? A. Place a pillow under their head. B. Administer CPR. C. Open the airway and ensure it remains clear. D. Give them a warm blanket. Answer: C. Open the airway and ensure it remains clear. This question tests immediate first aid priorities for an unconscious client. The key information is unconscious but breathing, indicating the most immediate life threat is an obstructed airway. Ensuring an open and clear airway, e.g., using a head tilt/chin lift, is paramount to allow the client to continue breathing effectively. For instance, an unconscious person's tongue can fall back and block their airway. Always prioritize the ABCs: airway, breathing, circulation, in an emergency, with airway being the first concern if breathing is present but the client is unconscious. Question 49. When assisting a client from a chair to a standing position, where should the PSW's hands be placed on the gait belt? A. In the middle of the client's back. B. On the sides of the client's waist, providing a firm grip. C. On the client's shoulders. D. On the front of the client's abdomen. Answer: B. On the sides of the client's waist, providing a firm grip. This question tests the correct hand placement for a PSW when using a gait belt during a sit-to-stand transfer. Placing hands on the sides of the client's waist, grasping the gait belt firmly, provides the most effective leverage and control for the PSW to assist the client in standing and maintaining balance. For example, If the client wobbles, the PSW can stabilize them by holding the belt at the sides. Proper hand placement ensures stability and reduces the risk of injury for both the client and the PSW. Question 50. What is an example of a physiological factor that increases a client's risk of falls? A. Living in a single-story home. B. Regular consumption of water. C. Dizziness due to medication side effects. D. Having grab bars in the bathroom. Answer: C. Dizziness due to medication side effects. This question differentiates between physiological and environmental fall risk factors. Dizziness due to medication side effects is a direct physiological factor, meaning it relates to the client's body and its functions, significantly impairing balance and increasing the likelihood of a fall. For example, some blood pressure medications can cause lightheadedness when changing positions. Understanding these internal risks helps the PSW identify clients who are more vulnerable and implement specific precautions.